If you or a loved one is living with cancer, you probably have two focal points: how to rid yourself of it and how to prevent it from coming back. You'll get some terrific information today on Cancer Concepts and Complements with Dr. James Belanger. We'll explore natural medicines which may enhance conventional therapies, share cutting-edge research, and offer insight on how diet and natural medicines can play an important role in treating and preventing cancer. The information presented herein is in no way intended as a substitute for medical counseling. Now, here is Dr. James Belanger.
Hello, welcome to Cancer Concepts and Complements. I'm your host, Dr. James Belanger from the Lexington Natural Health Center in Lexington, Massachusetts. Today's topic is ovarian cancer. Today we're going to talk about natural medicines that can possibly help improve the results in ovarian cancer, things that can be added to conventional therapies to help keep women with ovarian cancer in remission longer and to help prolong their life possibly. So today I'm going to review a lot of the research that's been done on natural medicines with ovarian cancer. Certainly more needs to be done, but I'm going to review the research that's been done so far. Ovarian cancer is the fifth most common cause of cancer-related death in women. Of course, breast cancer is, lung cancer is first, then breast cancer, but it's the fifth, ovarian cancer. And unfortunately, ovarian cancer presents in often later stages, and that's what makes it more difficult to treat. It's not caught early because there's not any routine screening that's done like mammograms with breast cancer. 70% of women that have ovarian cancer tend to present in the later stages, stage 3 or 4. In stage 3, it's already spread outside of the ovaries into the lymph nodes of the abdomen, or stage 4 when it spreads even more distantly like the liver or the lungs. Why so much ovarian cancer? What are the things that might put a woman at risk that has been studied so far in the literature? Well, one of those is obesity. Obesity increases the risk of ovarian cancer, and even if a woman has ovarian cancer, there's been research done in animals showing that obesity can cause the cancer to grow faster. There was a study that was done in this journal, Gynecology Oncology, in 2014, just recently, where they gave these mice that were either heavy, obese, ovarian cancer, or just normal-sized mice, and the ovarian cancer grew 3 times larger in the obese mice versus the normal weight mice. And the mechanism is that obesity, in a lot of women that have obesity have higher levels of insulin and something called insulin-like growth factor. And there's research showing, I'm going to talk about that later, that can potentiate and activate blood vessel growth factors in the cancer. And so a lot of doctors say, you don't want to lose weight when you have chemotherapy and stuff. But if you need to lose weight, it's a good thing to lose weight, to get down to a comfortable body weight, because it might even slow the growth of the cancer down. There's research on this for all kinds of types of cancers, that restricting calories can be a good thing. But healthy foods, eating lots of green vegetables, small amounts of animal proteins that are good quality, some small amounts of nuts and seeds and berries and beans, kind of like what you'd eat on the woods, just a low-calorie type of diet, not a lot of high-calorie foods. You'll get a lot of good nutrients from that, so you won't be deficient in any vitamin or mineral, but lose weight to the point to where your body wants to be, and that can possibly slow down the growth of ovarian cancer, and if you don't even have ovarian cancer, reduce the risk of getting it. Another thing about foods is what's called the glycemic load increases the risk of ovarian cancer and also increases the growth rates of ovarian cancer. Glycemic load is carbohydrates that don't have a lot of fiber. So if you're eating lots of white breads and white flour products and white rice and even something like a white potato or fruit juice, something that has a lot of carbohydrates, either from starch or from sugar, that doesn't have a lot of fiber in it. See, white flour, white rice, they've taken away a lot of the fiber. That can increase glucose into the body, like you'll get a big rush of glucose coming into the cells, and that increases this insulin, and insulin acts as a growth factor for breast cancer, and that has been shown to increase risks. There's a 72% increased risk of ovarian cancer in women that ate high glycemic load foods, That was studied in Public Health Nutrition 2007. Another thing about eating these kinds of foods, you tend to gain more body weight, and estrogen is made in fat tissue. There's a type of estrogen called estrone that is made in fat tissue, and ovarian cancer is sensitive to estrogen. So that's another mechanism besides insulin. Insulin and estrogen get increased with high glycemic foods and being obese. Another thing that might be causing an increase in ovarian cancer, or something that is something to look at as a possible treatment for ovarian cancer, is iodine. Iodine is a mineral that is getting more and more deficient in people because if you look at the tables, the nutrition tables, iodine is not really found in too many foods. It's found in seaweed, but not too many people eat that. It's found in seafood, but if you're not eating much seafood, you're not going to get iodine. Now, they add it to salt, but some people are getting away from adding salt to things or switching to a sea salt that might have some trace amount of iodine, but it's not added like iodized salt. Well, there's a study done, it's an old study back in the Lancet journal in 1976 that found that rates of ovarian cancer were inversely related to dietary iodine intake. So that it was a higher rate of ovarian cancer in women that didn't eat as much foods with iodine in it. And the mechanism, what does iodine have to do with possible ovarian cancer? Iodine has been shown to help modulate or modify estrogen levels in the body. There's actually 3 types of estrogen made in our bodies. One's called E1, E2, and E3. And E1 and E2, when they bind to ovarian cancer cells, they can stimulate the growth of them. And so they do use some conventional therapy that lowers estrogen, called an aromatase inhibitor, to treat resistant ovarian cancer. There's some research that might have some benefit. But iodine helps balance estrogen levels, shifting estrogen from what's called E1 and E2 to more of what's E3. E3 is actually a weak estrogen, and it competes with these other 2 more stronger estrogens and gets in the way of them, kind of gets in there, binds to the E1 and E2, displacing them, preventing them from binding to cancer cells and stimulating them. So that might be one of the mechanisms of how iodine, if you have enough iodine, your estrogen levels will be more balanced, should we say, so you don't have too much of those E1s and E2s that stimulate these hidden cancer cells that might be forming in your body. Estrogen also is tied in with the insulin growth factor system, and I just mentioned obesity and this glycemic load, increasing insulin growth factors in the body, and that's a risk factor for ovarian cancer and also stimulates the growth of ovarian cancer in women that already have it. Well, iodine can lower IGF levels, insulin growth factor levels. So that's something I'm going to talk about later, as you can measure insulin growth factors in the blood. And if it's elevated, iodine is something that often lowers it. Have either an iodine supplement or increasing the intake of sea vegetables like kelp and nori, like they make sushi out of. So, yeah, estrogen might be a risk factor for ovarian cancer. They call them a hyperestrogenic state, having too much estrogen in your body compared to another hormone, progesterone. And so being overweight, I mentioned you make more estrogen in fat tissue. Eating high glycemic foods, foods that have a lot of white flour, that don't have a lot of fiber in it, potentiate, amplify the estrogen in your system by affecting body fat and also by affecting insulin, which amplifies estrogen. Deficient in iodine might lead to imbalances in estrogen. But there's also estrogenic-like substances in the environment, like BPA, you might have heard of, that they're using to line a lot of canned foods. And they call them xenoestrogens, estrogens, compounds in our environment that mimic estrogen in our body. And, you know, the research on BPA said you have to have a lot of it for it to even do any harm. But there isn't much research where a small amount for years combined with all these other xenoestrogens. There's estrogenic-like substances found in plastic. They're given estrogens to animals. There's pesticides that might act like estrogens in the body. So there's a lot of things that might contribute to all this stuff together. So BPA is a good thing to avoid, because a lot of the animal studies that stimulate the growth of ovarian cancer, they're using BPA to do that from that same stuff that's in those cans. Bisphenol is what it stands for. So that's another thing so reducing those xenoestrogens. And like I said, that might be worse off because if you're overweight and you're eating the high glycemic foods, then having those xenoestrogens in the diet too. So a lot of green leafy vegetables, especially those in the cruciferous vegetable family, can help balance estrogens. The Brussels sprouts, the broccoli sprouts, the kale, the collard greens, and then sea vegetables would be a good thing to include in the diet. And then watching the carbs, eating, more like this paleo type of diet. If you're out in the woods, eating lots of those greens and small amounts of some animal products, not too much. And the animal products not containing hormones, so you don't get a dose of hormones every time you eat some animal product. And reducing the grains, especially the white ones, the man-made refined grains. Dietary calcium might also protect against ovarian cancer. There's research showing that women were less likely, half the rate of getting ovarian cancer if they consumed a high intake of dietary calcium versus those that didn't have hardly any calcium at all. Now, certainly there's dairy products that have calcium, but you want to make sure you buy the organic kind where there's no hormones added, and grass-fed dairy products. Because, if the cow eats corn, then the type of fat that's in the dairy products are full of omega-6 fats, and those omega-6 fats aren't healthy for us. We want to eat the milk the way it comes in nature from grass-fed animals. There's actually omega-3s found in grass, and if the animal eats grass, the milk contains that, and we get a dose of omega-3s from the dairy products. So there's calcium certainly in dairy products, but you don't even have to eat dairy products to get calcium. There's lots of calcium in kale and collard greens. And those foods have other compounds in it. They call them indoles, and these indoles help balance estrogen. So the kale and collard greens are a better choice, in my opinion, because you're not only getting the calcium, you're getting these indoles, plus they're full of magnesium and vitamin K and something called beta-carotenes or carotenoids. Very healthy vegetables to have. Plus they're lower calorie than dairy, and lower calories leads to reduced risk of getting ovarian cancer. And if you have ovarian cancer, it doesn't grow as much when you have less calories. So kale and collard greens are very low in calories, but packed full of all kinds of vitamins and minerals and calcium, which is another thing that protects. Other things that might protect is tea. More women that drank tea had lower rates of getting ovarian cancer. 4 or more cups, there was 2/3 the risk of getting ovarian cancer than those that didn't drink any tea. And it didn't matter what kind of tea, black tea, green tea, herbal tea. This is a study done in Cancer Causes Control 2010 in Australia. So drinking tea is a good thing to lower risk. And we're going to talk later about there's compounds in green tea that in very high doses, pharmacological doses, can also inhibit the growth of ovarian cancer. Mushrooms, especially the white button mushroom. You always think about the white button mushroom maybe is not as healthy as some other mushrooms, but the white button mushroom has this compound in it. It's called an aromatase inhibitor. It inhibits the production of estrogen from fat tissue. I mentioned that if you are overweight, you do make estrogen in fat tissue. And there's this enzyme called aromatase in fat cells that turn adrenal hormones into estrogen. And then estrogen can stimulate the growth of ovarian cancer. And mushrooms, the white button mushroom, has a natural aromatase inhibitor. And there's research showing that women that consumed 2 grams per day, which is nothing, it's like less than one mushroom, white button mushroom, had a 2/3 risk of getting ovarian cancer than those that didn't consume any. So just adding 1 white button mushroom or so to a salad or something a day, could be a useful thing. Plus eating mushrooms if you have ovarian cancer, the white button mushrooms. We're going to talk about other mushrooms, Coriolis mushroom, which is called the turkey tail mushroom, Agaricus blazei mushroom. Those have been studied in like concentrated extracts to treat ovarian cancer. Okay, so conventionally, pretty much every woman that presents with stage 3 or 4 ovarian cancer gets these 2 drugs. One's called carboplatin and one's called Taxol. And they give it every 3 weeks or so. for 6 cycles. And they do this often after surgery. So they remove as much ovarian cancer as they can, and then they give these 2 drugs, carboplatin and Taxol. And the overall response rate is 73%. So it either shrinks down any residual amount of disease in 73% of the women. And there's this tumor marker called the CA-125 that can be really high before the surgery, and then it goes down to maybe sometimes just a little bit above normal. And then with the chemotherapy, if a woman has a good response, then this tumor marker, CA-125, goes down to normal. And, some women can, depending upon how much the surgeon's able to remove, can have a good remission period lasting up to, say, 22 months after doing this carboplatin and Taxol with the surgery. But if a surgeon wasn't able to get out all the disease and left more than 2 centimeters or so of the disease, then the remission period will be shorter, about 18 months. And so pretty much after the chemo is finished, a woman is left to kind of watch and wait, and they do this tumor marker, and they do CAT scans, and they see if it comes back. And there really isn't anything, except for maybe a clinical trials that a woman can enter, that they can go on in this interim period. This is the major period that natural medicines can really shine. I'm going to talk about some blood tests that can be done to help see if a woman's at risk for a reoccurrence, and things that you can do to stop that reoccurrence by taking away things that could stimulate the growth of residual cancer that's still left. So it's a really important period, because when it comes back, they put a woman back on carboplatin and Taxol, and it might work for another 9 months, but eventually they become resistant to this carboplatin and Taxol, and then they have to pick drugs that are in a different family. So they use this drug called Doxil or gemcitabine or topotecan, and after the cancer is already resistant, these other drugs have very low response rates, only say 20% response. They only work in 20% of the people, and they only work for about 3 months, and then it becomes more resistant. So in my opinion, it's really key time after the first set of chemo drugs are done and the surgery is finished, during that watch and wait period, to be on some natural things, to do some lab tests, to make some dietary changes to help prolong that remission period as long as possible, and go for the cure, so you don't have to go back on chemotherapy later, and lead to this just controlling the disease with chemo and prolonging life with chemotherapy. So I got to take a break, and when we get back, we're going to start talking about some laboratory tests that can be done to monitor people in that remission period to see if they're at risk and what can be done to manipulate and stop that from happening. This is Cancer Concepts and Compliments.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hello, welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger from the Lexington Natural Health Center. Before the break, I was talking about some chemotherapy regimens that are commonly used for ovarian cancer. Pretty much every woman I have seen, when they're diagnosed with ovarian cancer, after they have surgery, they go on these drugs called carboplatin and Taxol, because they work very well for a period of time. They can keep a woman in remission for up to a couple years if they have stage 3 or maybe 4 disease, depending upon how much the surgeon was able to remove. And they often work again after the woman has a reoccurrence. They try them again, and they can work for maybe another 9 months longer. But when they stop working, then a lot of times doctors will try drugs in different families than carboplatin and Taxol. So they'll try a drug called Doxil, or a drug called gemcitabine, or a drug called topotecan. Or then also there's a non-chemotherapy drugs that are being used, like there's this drug Avastin, which can be very good because it inhibits blood vessels. It works a different way than chemotherapy. But there is a test, and I've been talking about this in the last two shows. There's this lab called RGCC in Greece that you can send a blood sample to. They'll take and find cancer cells, ovarian cancer cells from the blood. They'll grow them in the lab, and they'll incubate them with different types of chemotherapy drugs like Doxil, gemcitabine, topotecan, and see which ones cause cell death the best in ovarian cancer. And this will be really important in a woman that has had a reoccurrence to see, and they're not, the carboplatin and Taxol is not working anymore. They're resistant to them. What's the next drug to pick? In my opinion, this should be done right off at the beginning, but a lot of doctors go right to carboplatin and Taxol because they're well researched and have the best effects. So at least doing in the third line therapy, they call it, when they're resistant to platinum drugs, and they've tried them, to pick what is Doxil going to be better? Is gemcitabine going to be better? Topotecan? Because everybody's an individual, and sometimes Doxil work great for one woman and not for somebody else, and this test can help wean that out. It's called RGCC, chemosensitivity panel. But during the interim period, after a woman's in remission, either after the first set of chemo or the second set, laboratory tests should be done to see if there's anything in a woman's system that could put her at risk for getting a reoccurrence. Ovarian cancer likes blood vessels, and it tends to hang out in the lining of the abdomen. They call it the peritoneal lining. There's a lot of blood vessels there, so it hides out in there, and it secretes these blood vessel growth factors so that it can form roads, you could think about it. So there's these little colonies of cancer cells that were not removed from surgery because the surgeon couldn't see them because they're microscopic. They weren't killed by the chemotherapy because they were more resistant cells. And they stay in the body, often in the abdominal lining, and they then start up shop by making these blood vessels, and they make the blood vessels, and in come these roads. Now they're getting lots of nutrients to start to grow, and then they start to grow to a certain amount where then you can see a rise in the tumor marker, the CA125, and then eventually something shows up on the scan. But you can measure certain things in the blood that cancer is using to make the blood vessels that will often go up before the tumor marker CA125 rises, and even certainly before a CAT scan would show it. And yes, the drug Avastin has been a good breakthrough because it does take away one of those blood vessel growth factors. It's called VEGF, vascular growth factor, and they're starting to use that more and more with ovarian cancer. And at least so far, when a woman already has become resistant to platinum drugs, Avastin can work about 30% of the time and keep a woman stable for up to about 5.5 months. So it's not a great effect, but a start. And why isn't it, a great effect if it inhibits blood vessels? It's because the cancer makes blood vessels many ways. So, think about it as these roads. Okay, you take away the asphalt so you can't make a road. Well, you make a stone road or a cement road, dirt road, something like that. The cancer, if it doesn't have VEGF from the Avastin, it can use other things. But VEGF is an important thing to measure. There's research that's been published showing that if a woman has elevated level of VEGF, they're likely to respond to Avastin. But it can't be too elevated. If there's lots of this growth factor, Avastin won't be strong enough to, in essence, block it all because there's just too much of it. So you can measure VEGF in a woman that's on Avastin, and she's more likely to respond if that VEGF level is less than 540. Women that had a VEGF less than 540 had a 60% response rate to Avastin. Those that had it greater than 540 had a 0 response to it. And why? It's because it was too much for the Avastin to block. There's natural medicines that I'm going to talk about in a little bit that might help add to Avastin. So women that do have a level higher than 540 will respond to it. But yeah, the lower the VEGF, the better. So it's really important to get that blood level as low as possible. So this is a blood test that can be measured at a lab called LabCorp, Quest Diagnostics, but LabCorp is the one I use. They do what's called a serum VEGF. They measure that growth factor, and we want to see that level as low as possible. There's research done in gynecologic oncology in 2004 in North Carolina. The median survival was 14 months in patients that had a VEGF less than 341. Those that had it higher than 341 has 9 months survival. Another study, anti-cancer research, when it was less than 100, the VEGF survival was 35 months versus 28 months in those that had over 100. So striving for less than 100. And a lot of times Avastin can bring it down pretty low. But if it doesn't, green tea is something that could possibly be added. There's a compound in green tea called EGCG. They think that is the active compound, and there's certainly some of that every time you drink a cup of green tea. But the research that's been done has been done on very large doses of EGCG. So they've done studies in animals where they give EGCG to these animals, and 33 days later, they take the tumors out and they measure blood vessels in the tumors. And there was a 60% reduction in them, and the tumors were smaller. And when they measured the amount of this VEGF in the green tea group, it was lower. So green tea, or EGCG, again, very large doses. Like they used 800, and a human equivalent of 800 in this. This was an animal study, and that would be way too many cups of green tea. So they have pills out there for this purpose, and they're generally well tolerated. Sometimes a person gets nausea from it, but adding food to it, taking it with food is helpful. There is some reports showing that green tea pills can raise liver enzymes. I've never seen that happen before, but it's something that has been reported and that can be monitored easily, and the liver will repair itself if that happens. You just go off of it, and the liver enzymes will normalize. But I've never seen that happen, and I suspect it was the particular type of product used in that research rather than some of the products that I use that might be more free of solvents. It could have been something else in the green tea. But green tea is one thing. Another thing is there's this compound found in this plant, wormwood. There's a plant called wormwood that they use to treat malaria, and it's been studied in China. This compound called artesunate, which is a compound found in wormwood, given to ovarian cancer in mice. And then again, they measured VEGF levels and found that it was markedly reduced in the animals that were given artesunate from wormwood, and it reduced the amount of cancer. So when Avastin isn't working or the VEGF levels aren't going down enough, EGCG from green tea or artesunate might be another useful thing. But even if you get the VEGF levels down to as low as possible, the cancer can start to use other things. And that's like I mentioned with the analogy, you take away the asphalt, you can't build the asphalt road, well, then you start building other types of roads. And that's exactly what the cancer does. You take away the VEGF from it, it finds other ways. And there's research in this journal, Translational Oncology, in 2013, that says that ovarian cancer cells will secrete all kinds of other growth factors, and the VEGF receptor blockers will not stop that. There's something called HGF, hepatocyte growth factor, PDGF, platelet-derived growth factor, SDF, stromal derived factor, insulin growth factor, which I mentioned earlier, transforming growth factor, MMPs, UPA, FGF. There's all these other ones out there. And so a more successful approach would be to try to stop a lot of these growth factors being secreted by the ovarian cancer, so it won't be able to build those roads or those blood vessels that it needs to completely starve it. And then at the same time, and this is all during that remission period, get the immune system to start seeing that cancer. I'm going to talk about that later. There's often a defective immune response against cancer. And so the cancer just comes back because it's not getting attacked by the immune system. So twofold approach: starve the cancer of the blood vessels, taking away all these things that it needs, and at the same time get the immune system to attack it better. And this is all after it's been surgically removed and reduced with some chemotherapy. Okay, so there's all these other growth factors. One of them is called HGF and PDGF, hepatocyte growth factor, platelet-derived growth factor, and green tea has been shown to reduce those as well. This EGCG can reduce that. So EGCG or green tea seems to be a very useful thing that should be studied more, because it's more of a broad spectrum blood vessel inhibitor. It affects VEGF and then at least these other two factors. Then there's this other growth factor called SDF, stromal derived factor. And this is something that's interesting, that cancer cells will start to make it, the ovarian cancer cells will make it, and will cause the bone marrow to start to release these cells. They call them progenitor cells. They're cells that can turn into blood vessels. So the bone marrow becomes a factory for the cancer. The cancer secretes this SDF, and it causes the bone marrow to release these cells that go over to the cancer, wherever it is, and start building the blood vessels. So it's like recruiting contractors in to start building some road out into the woods. And that's what SDF does. So it's important to measure. You can measure SDF, And, if it's elevated, certainly you want to lower that or at least do things to keep it down. And there's some research done in a Journal of Obstetrics Gynecology Research where they took 54 women with ovarian cancer and compared it to just women that didn't have ovarian cancer, found that those that had elevated levels of this SDF were more likely to have lymph node disease and have a higher stage. So it's another growth factor that's not going to be affected by VEGF inhibitors like Avastin that needs to be kept under control. And there's this natural compound. It's called Indian gooseberry, or amla is another name for it. So it's this berry from this plant that's often grows in India. And they gave ovarian cancer to mice, and then they gave them either a control. They had a control group, and then they gave another group this amla, this Indian gooseberry, and equivalent to about a gram, not even that much of this. And then they just did it for 18 days. Then they sacrificed the mice and looked at the ovarian cancer. And the amount of cells that they injected into the animals was the same 18 days later. Didn't grow at all in the AMLA group, where it grew 200 times the original amount in the group that was just given the control. And when they took out that little bit that was there was hardly any blood vessels in it, so that it really stopped those blood vessels. And what it did was it reduced this HIF expression. HIF is this compound that induces this SDF. So in essence, it does affect this SDF growth factor. It reduced it by 90%. It took that away. And this HIF induces SDF and a whole bunch of other blood vessel growth factors. So AMLA would be a really useful thing to do a human study on, Indian gooseberry. It's a berry. I've used it. It's very well tolerated, and it's showing some pretty profound effects in animals. And another thing besides blood vessels, it stimulated the breakdown of the cancer. So it caused the cancer to kind of digest itself. It stimulated, they call it autophagy, self-digestion, basically. And there's this protein called Beclin-1 that it affected. And when they've studied Beclin-1, they found that women that have more aggressive types of ovarian cancer, the ovarian cancer produces a lot of this Beclin-1, and that prevents it from breaking down. Well, this AMLA helps inhibit that. So it has a twofold effect. It inhibits blood vessels and stimulates the cancer to break down. So very useful thing. All right, so we have a list now that's accumulating. We got VEGF, we got PDGF and HGF. All might be inhibited by green tea, and I mentioned artesunate. And now we got this SDF, stromal-derived factor, which might be affected by AMLA, Indian gooseberry. And these all can be measured to see if they're elevated in a woman that's in remission, to see if that needs to be given, or they could just be on a green tea supplement and an AMLA supplement. Then there's IGF. So I've talked about having high levels of insulin growth factor can be a increased risk of getting ovarian cancer, but also the ovarian cancer can grow more when IGF is elevated. Now, not just any IGF, the particular IGF called IGF-BP2. They've done research in this journal, Endocrine-Related Cancer, in 2014, where they measured IGF-BP2, it's called insulin growth factor binding protein number 2, in women, and found that those that had more advanced stages of ovarian cancer had higher levels of this. So this is something that you want to monitor. If it starts to rise while a woman's in remission, the cancer could start to be using this insulin growth factor. The insulin growth factor binding protein basically helps the cancer bind IGF, and it prevents it from undergoing cell death, and it stimulates basically growth pathways in it, and it leads to blood vessel growth. So you can monitor this and do things to keep it down. Well, caloric restriction has been shown to inhibit the IGF system, an overabundance of IGF. And so another thing, if you need to lose weight, you should lose weight, especially during that remission period. Get your body to a level it wants to be, not eat those high glycemic foods, those white flour products, the fruit juice, the white rice, the sweets and desserts, and be on a lower calorie but nutrient-dense diet. Research done in OncoTarget 2014 showed that mice that were on a high-calorie diet, the ovarian cancer spread more into the abdomen, the diaphragm, the bowels, the liver, the kidneys, the spleen. And its mechanism of action is a high-calorie diet stimulated the levels of this IGF, and it even affected VEGF. Other research showing is having phytoestrogens in the diet, plants that have a estrogenic-like effect, that they actually block the effects of estrogen in the system by competing with your own estrogen. If you're a bit overweight, you make estrogen in fat tissue, and having plant-like estrogens like found in soybean and in flaxseed might get in there, block the effects of your own estrogen in stimulating the growth of these tiny deposits of ovarian cancer that might be in the body. There's research showing that women that ate soy foods have lower rates of getting breast cancer. And I'm talking like organic, non-genetically modified soy foods. But there's a compound in soy called genistein that will compete with estrogen and insulin and prevent those things from stimulating the growth of cancer. And that's been researched in animals with ovarian cancer. Flaxseed has also been studied in hens with ovarian cancer, showing that it reduces the severity of the ovarian cancer when the hens ingested flax seeds. Okay, so we got to take another break. This is Cancer Concepts and Compliments.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hi, everyone. Welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger from the Lexington Natural Health Center. Before the break, we were talking about how ovarian cancer cells like blood vessels, and they do many things to make the blood vessels that they need to get enough nutrients and fuel to help grow into a larger mass and then show up again on a CAT scan and cause a tumor marker, CA-125, to rise. So it's really important during the remission period to do everything possible to take away those blood vessel growth factors from the cancer so it doesn't start to grow back, and then you don't have to go back on a chemotherapy regimen again and again. So these things can be monitored because there's very little that is tested in the blood in a woman that's in remission. They check CA-125 commonly, and that's pretty much it that I have seen. And when it starts to rise, then eventually they might do a scan and then back on the chemotherapy. So you can measure VEGF. I've talked about that. You get that thing down, that takes at least one growth factor away from the cancer, might prevent a reoccurrence. But it's not that simple, unfortunately. The cancer can use other blood vessel growth factors, HGF, PDGF, and then this stromal derived growth factor. And now another one is called MMP. MMP is, there's actually a whole bunch of them. They're MMPs, they're called. They're enzymes that can be released either by the cancer cells themselves or cells that are surrounding the cancer, called inflammatory cells, that basically break down whatever's in the way of the cancer so it can get more blood vessels and nutrients, so it can expand. I always tell people, think of the MMPs as like, okay, you're going to expand your house, and there's trees in the way, you cut down the trees, you can expand your house now and access a nearby road too. MMPs are enzymes released by the cancer cells and the cells that surround it to break down and makes the cancer more invasive. So there's research showing that many of them can be measured in the blood, and like one's called MMP9 or MMP2. And then you can measure other things I'm going to talk about later, clotting factors that can indicate that MMPs are being released as well. But there's a Chinese formula. It's called, I'm going to probably mispronounce this, Exrian decoction, or ERXIAN decoction, studied in the Integrative Cancer Therapeutics 2013. This is a formula that's commonly given to women for menopausal symptoms to help relieve hot flashes and stuff. And it contains this herb called epimedium and another herb called curcuglio. But it has a bunch of other herbs in it. And it's been given to animals with ovarian cancer, and it reduces the growth of the cancer. versus a control group, and its mechanism of action was that it reduces the release of these MMPs. See, so this was an in vivo animal study where they measured these things and it reduced it. So that's something that needs more research, but that might affect some things that Avastin doesn't affect and other blood vessel inhibitors don't affect. Okay, now cancer can also activate the clotting system. I'll get something to think about. Say you cut your hand, right? You cut your hand. What just got cut? Blood vessels just got cut. Then you form a clot, seals up the wound. Over time, it heals and it's gone. The blood vessels knitted themselves back together. The activation of the clotting system helps stimulate blood vessel growth. That's why it's activated when we cut ourselves. So the blood vessels that just got cut can now repair and grow back together. Cancer cells, because they rely on blood vessels, will activate the clotting system for the same purpose, to build blood vessels. And so you can measure all these clotting factors in the blood. And if you see elevated levels of that indicate there's an activation of the clotting system, that can mean hidden amounts of cancer that need to be dealt with. Now, these aren't specific to cancer. Certainly, if you had some, you don't want to do this right after having the surgery for ovarian cancer because that's going to be activated, or after, you took a major spill or something like that. But if you don't have any wound in your body and you find elevated levels of some of these clotting factors, which include something called fibrinogen, antithrombin 3, D-dimer, that might indicate some small amount of cancer in the body. And again, if you do something about it, you stop these things from being made, then that can help prevent those blood vessels from growing. So there's research showing that ovarian cancer cells will release some compounds that attract inflammatory cells into the area. They like these inflammatory cells. They're called M2 macrophages and neutrophils. They're cells in your own body that actually help make blood vessels, basically. And the ovarian cancer will attract them, and in come these inflammatory cells, and the inflammatory cells make something called fibrinogen and something called tissue factor. And fibrinogen then helps bind more inflammatory cells and brings them in. And it also binds blood vessel growth factors like that VEGF that I've already mentioned, and this other one called FGF. And now you have factors that help the blood vessels that are nearby sprout and come to the area. It also activates something called tissue factor, which activates thrombin, which stimulates also these MMPs to be released to break down anything in the way so the nearby blood vessel that's nearby can sprout and come towards it. So that's what happens. You got to break down whatever's in the way with these MMPs and other compounds, and then stimulate the release of VEGF and other blood vessel growth factors so a nearby blood vessel comes towards it. And that's all induced by these inflammatory cells. So one thing you can do is you can measure fibrinogen. And women that have elevated levels of fibrinogen are more likely to have advanced stages and more poor survival outcomes. There's a research study done in the Clinical Application Thrombosis Hemostasis 2006. There's a lot of research done where fibrinogen can be used to monitor. You want to make sure that fibrinogen thing, because it binds those blood vessels, blood vessel growth factors, you want to make sure that is at a good level. There's another study in the Oncologist Journal in 2009 where they said women that had normal fibrinogen had basically twice as many were alive at 5 years than women that had elevated levels of fibrinogen. So it's a simple blood test. And then you can measure something called D-dimer and antithrombin 3. These are some other things. You can measure what's called plasma viscosity, how thick the blood is. If the blood is too thick, that indicates also the clotting system is being activated. And there's research showing that women that had thicker blood also had worse survival. That was published in a journal, Clinical Hemorheology and Microcirculation in 2000. Okay, so you do these blood tests, fibrinogen, D-dimer, antithrombin 3, plasma viscosity. You check anything abnormal. You want to do something about it because it can indicate that cancer is starting to try to make those blood vessels. Well, one natural compound that looks very promising is Gingko. Ginkgo is an herb. A lot of people take it to help improve their brain, and they've done studies showing that it helps improve blood flow. That's why it's been shown to maybe help memory, improves blood flow to the brain. but it's been shown to help improve blood flow to the fingers. Men with erectile dysfunction, ginkgo's been studied. Circulation problems in the legs, ginkgo. And the way it works is it helps the blood flow better by inhibiting the binding of red blood cells to this fibrinogen stuff. We already have fibrinogen in our blood. We have a normal amount. But if you have too much, the blood cells get stuck to this fibrinogen, and in tiny little capillary beds, they'll clump more, and that leads to low levels of oxygen in the cancer. When the cancer's not getting enough oxygen because of poor blood flow to it, it will release that HIF thing that I was talking about with Indian gooseberry, and that will induce more blood vessel. So, the cancer's kind of happy when it's getting its oxygen. When it doesn't get its oxygen, it will become more aggressive and release more blood vessel growth factors that cause more blood vessels to come into the area. So ginkgo has been shown to improve blood flow, decrease viscous, thick blood, might lower fibrinogen. There's numerous other things too, but they haven't been studied with ovarian cancer just yet, but they really need to be, like lumbrokinase is an enzyme that might help lower fibrinogen. But curcumin, found in turmeric has been studied a little bit with ovarian cancer, and that also affects fibrinogen pathways. Okay, now, so we starve in the cancer of all these blood vessel growth factors. That's certainly important. That will kind of keep them at bay, so they won't be able to start to grow into big mass. But it would be great if we could eliminate them. The immune system is what will eliminate them if it's properly supported. So why doesn't the immune system see the cancer in the first place? It's because the cancer can surround itself with what are called suppressor cells. It builds like a set of guards around itself, taking cells from your own body to use them to protect themselves against other cells in your body that kill them. These cells are called suppressor cells, and there's different types. There's one called the regulatory T cell, and there's one called the myeloid-derived suppressor or myeloid-derived stromal cell, which inhibits our killer cells from attacking the cancer. And these suppressor cells will start to accumulate more if the cancer is releasing compounds that attract them. There's one compound called IL-10 and another compound called TGF and numerous other ones that attract suppressor cells, causing the cells that are surrounding the cancer to protect it rather than to kill it. So we want to measure those things. You want to measure TGF, transforming growth factor, it's called. You want to measure interleukin 10 and other in what's called regulatory T cells. And if they're elevated, do something about it so that possibly the immune system will be able to eliminate that. Well, so there's research done measuring those things. Interleukin 10, for example, showing if it's elevated, women are more likely to have more aggressive ovarian cancer. So we want to make sure interleukin 10 and these other things are normal. So I measure those very frequently. They can be done at many laboratories like LabCorp is one I used. Ginseng, there's something called Panax ginseng that has an ability to correct the immune system in reducing these suppressor cells. And there's research showing that ginseng combined with chemotherapy makes chemotherapy work better and also helps correct an impaired immune response. There's a mushroom called Agaricus that has been shown to reduce interleukin 10 that has also been studied with ovarian cancer in animals. Agaricus blazei, it's called. There was a study done, Journal Cancer Research Clinical Oncology 2005, where they gave mice Agaricus and measured the cancer versus a control group, and the cancer basically wasn't able to spread to the lungs and the abdomen as easily, and it helped lower this interleukin 10 and other suppressive factors and increased natural killer cells. We have cells in our body called natural killer cells that are designed to destroy and kill cancer, and they're often not functioning well in women with ovarian cancer. They've done studies where they take women with ovarian cancer and measure their natural killer cells and find out that many of them have impaired natural killer cell function. So their immune system, these killer cells, aren't able to destroy the cancer. And then on top of it, the cancer is protected by the suppressor cells. So Agaricus blazei seems like a really good thing to do more research on because it inhibits the suppressor cells, and at the same time, it helps increase the activity of the natural killer cells. So you can actually measure natural killer cell function in the blood. You can send a sample to a lab where they take your killer cells out of your blood, mix them with cancer cells in the lab, see how well they kill them. And if they're not killing them very well, then you can do something about it. Agaricus blazei might be a useful supplement. There's another one called PSK, which is from this mushroom called the turkey tail mushroom that can help. I'm running out of time, so I hope you got a better understanding of things that can be done, especially during the remission period, so you don't have to get back on chemotherapy later. Doing blood tests to check for blood vessel growth factors, which can be done at many different laboratories, and then using that to guide you on basically a supplement regimen, dietary regimen that can help stop those growth factors. And then checking the immune system, seeing how many of those suppressor cells you have, factors that increase suppressor cells, decreasing that in the blood, and stimulating those natural killer cells and those cells that help kill the cancer. Well, I hope you enjoyed today's show. Next week's show, we're going to talk about colon cancer. I'm going to go through the same kind of format, talking about things that influence the growth of colon cancer and natural supplements that might help prevent that from happening. This is Cancer Concepts and Compliments. I'm Dr. James Belanger.
Thank you for joining us this week. Cancer Concepts and Compliments with Dr. James Belanger can be heard live every Tuesday morning at 6 a.m. Pacific Time, 9 a.m. Eastern Time on the Voice America Health and Wellness Channel. We hope to see you next week for another show.